Sawasdee Good afternoon once again. Today is Monday, the 2nd of August, 2021. So here at the CCSA, before I came to the podium, we had a number of speakers. I'll go through the gist of what they presented in a short while. Firstly, of course, Dr. Pisamai for the Thai language general briefing that we had. So we heard from Dr. Supakit Sirilak, the Director General of the Department of Medical Sciences first, on the use of the ATK or antigen test kit for home use. The Government Pharmaceutical Organization or GPO had approved 19 brands already for commercial sale, for commercial use. And out of these 19 brands, 17 are from testing from the excrements, as well as the other 2 are testing from saliva samples as well. So this would be available commercially, but of course in pharmacies, not in the unauthorized vendors, of course. We also heard from Dr. Nathapong Wongwiwat, the Deputy Director General of the Department of Medical Services, on the measures for people who have been tested positive from testing the ATK or antigen test kit, which include home isolation. He showed us a plan of the flow chart of what would happen if tested positive using the ATK antigen test kit. Home isolation, community isolation, hospital, or at the hospital itself. And lastly, we heard from the Assistant Secretary General of the National Health Security Office regarding the work of the hotline, which is 1330. This is the hotline of the NHSO, which would coordinate for those who would need beds, as well as coordinate on home isolation services as well. There had been, of course, a lot of telephone calls to this hotline number because of the increasing number of home isolation and the need for hospital beds. The hotline number would, of course, first provide service in evaluating the level of infection of each patient, whether it's red level, the highest, or green level, which is the asymptomatic patients, and of course provide the necessary advice before a bed is available in a hospital or before medical services are provided. Mostly it is for those who have to remain in home isolation. I'll start off first with the vaccination progress that we have for today. Yesterday was Sunday, we administered 180,552 doses of vaccines, increasing the cumulative number of vaccines already administered in Thailand to almost 18 million doses. And from yesterday onwards, the Ministry of Public Health has adjusted the distribution plan, extending it, of course, to those who are in the general public, the 18-year-old public group, as well as continuing with those who are the elderly, as well as 7 underlying diseases who register in advance. Now, the vaccination plan for August, we're in the beginning of August right now. The CCSA has set the target for August, and you have an infographic there on screen for you, to vaccinate as a target in Bangkok 80% of residents, as well as 70% of residents in the maximum and strict control zone provinces. That would be the dark red zone provinces that we highlighted yesterday, and today I'll highlight that, recap that once again, the number of provinces which are in this particular group, as well as planning in August to vaccinate 50% of residents in the other provinces across the country. So for the vaccination of foreign residents, just to recap what was mentioned yesterday, the portal that we opened, of course, we talked about that already. I'll start off first with the number of accumulated foreign residents that have been vaccinated. So as of July the 31st, we have that as over 12,000. These include the diplomatic corps, those being vaccinated through organizational arrangements, representative of international organizations, foreign media, expats in particular organizations, and foreign nationals age 60 plus. So as you can see, this is a cumulative number of foreign residents in Thailand in various schemes so far. One of the latest schemes was the one in Bang Su Grand Station for those living in Bangkok and surrounding areas, particularly first doses, first vaccines for those 60 and over. So that was one of the latest schemes. Another latest scheme is of course expatvac.com that we talked about yesterday. On Pfizer, I think we may have some graphics for you. We have that the CCSA approved the allocation of some 150,000 doses of U.S. donated Pfizer COVID-19 vaccine to foreign residents in Thailand. And you have some pictures and information up there, the press release and the sort of like a handover event that when we received the vaccines from the United States. So thank you very much to the United States for that assistance to Thailand. We have also yesterday, as I was mentioning just now, the website, the link, which is called expatvac.consular.go.th, wherein the Ministry of Foreign Affairs, in collaboration with the Ministry of Public Health, launched this website on the 1st of August, yesterday, to foreign residents of all age groups nationwide to register for their first dose of vaccine, and the registration is online, of course. So this is the latest scheme, and as you can notice, it targets the general foreign resident population, 18 plus, and you have some pictures there if you go into this portal. If you notice, this is the priority, the same priority, a priority which is in line with the priority for the general Thai public population as well, meaning 18 and above in different categories. And you see in the on screen right now, you have the the information that you can find when you go into these sites. And also there are also bar tabs that you can click in to fill in the form for registration, foreign residents of different types of visas, as well as the migrant workers, which this group particularly you'll be led to the portal of the Ministry of Labor, which they had been registering migrant workers for vaccination for some time already. So this portal actually covers practically all the groups already that have yet to be vaccinated. So this is for those who have registered in the Bang Su scheme, that's for those who are 60 to 74 years old. The records would be automatically transferred to this new website, expatvac.com, and those who registered will be notified of the dates of the vaccination sites, the area, the location for the actual vaccination sites, according to the level of risk and location of the residents. And of course, bring your documents. In addition, we have Thai students who remain yet to be vaccinated, a part of them. A few months ago, we had a scheme which vaccinated most of them already, but of course some remain. And the Ministry of Public Health will be announcing the details for Thai students who are scheduled to go abroad, as well as athletes who are scheduled to compete in international tournaments. The Public Health Ministry will announce the details for this vaccination procedure in due course. For the general situation, I'll just go through that briefly. We have some infographics coming up as well. We have a new confirmed case at 17,970, as you see on screen. And in terms of recoveries, 13,919. You can see that the cycle of recovery is increasing already with 13,000 new recoveries. New fatalities, 178, making the cumulative total fatalities at 5,000, over 5,000. The fatality rate is 0.84% now. Active cases currently being treated is 208,875, as you see on screen. Just to recap, yesterday the CCSA tightened the various disease control measures which would be effective tomorrow on the 3rd of August, actually tonight, midnight on the 2nd of August, Monday, but in practical terms, it will be effective on Tuesday, the 3rd of August, and of course reviewed in 2 weeks, but possibly extending until the end of August. So for the new measures that we announced yesterday, you have the new zoning, new recategorization of provinces. You have that on screen. I'll just talk a little bit about this screen. You see in the dark red area, which is the maximum strict control areas, it has been increased to 29 provinces. And going lower, one step, you have in red, maximum control area, which currently has 37 provinces. Now, just a little bit about this group. That some provinces in the maximum area, the one in the middle, some provinces such as Kalasin, Khon-Kaen, Mahasarakham, Yasothon, Roi Et, Srisaket, Ubon Ratchathani, and Amnat Charoen. Some provinces that I had mentioned just now are in the red zone, but they have quite a high number of new infections, newly infected cases. However, they have not been moved up to the dark red zone yet, because most of the cases in these provinces that I mentioned are mostly imported from the dark red zones, Bangkok included. So most of the cases in these provinces are imported from the dark red zones and not indigenous cases. And Dr. Apisamai just now mentioned about the imported versus the indigenous cases in one of the charts that was shown in the Thai language version. Most of these provinces in the red zone were imported and not indigenous, but if statistics find, if data is found that most of the cases are becoming indigenous, meaning locally found, locally originated, then it would be something that the CCSA would be considering in moving them up to the dark red area. So another part of the new measures that we talked about yesterday was about the restrictions to contain the COVID transmission for each of the areas, maximum controlled, maximum and strict controlled, maximum controlled and controlled areas. And you see that on screen. Just a note that yesterday there was some information which we would like to clarify and make correct right now, that in shopping malls in the dark red zone, the restaurants are open for delivery now. They are not open for takeaway, but open for delivery. So there's a difference there. And I think some press had been reporting that information. So just to correct this for everybody. And you have all the other measures you see on screen for the different zones, noting that for the dark red zones, in terms of travel restrictions, no public transportation services across provinces. And of course, starting tomorrow, the revised disease control measures will include the public gatherings as well for each particular zone. You have dark red as on the highest part, which has no public gathering for more than 5 people. And then the red zone, which is the maximum controlled, no gatherings more than 20. And controlled areas, which is no gatherings more than 50 people. And you have a recap there of the tightened disease control measures for the various business establishments in each zone, including one point which is important is the workers' camps in the Bangkok and surrounding areas. There's a lot of those, 600 plus workers' camps, in the form of sealed routes or bubble and seal measures. And for tomorrow, the curfew in the maximum and strict controlled areas, Bangkok and the surrounding areas, would apply to 29 provinces now that you saw in the dark red zone chart just now. So the curfew for 29 provinces between 2100 to 0400 hours, 9 p.m. to 4 a.m. in the morning, as well as the other restrictions that was mentioned just now. Now, Now, that was a recap of what happened yesterday. So by tonight, of course, the new restrictions would be put in place, and come tomorrow, we'll have more provinces that have to bear with stricter measures. 29 provinces would have to bear with stricter measures, just like Bangkok. This, of course, is for precaution. This is for the better, for us to be able to control the outbreak at the moment right now. And yesterday we also talked about Phuket and Phang Nga. The Phuket sandbox scheme continues. We are mindful and cautious of the various cases that have arisen in Phuket provinces, and Phuket province and other provinces nearby, other provinces which are following suit for the Phuket scheme, for example, Phang Nga, for example. So therefore, some adjustments are being made in these provinces which are opening for in the sandbox type of scheme. For Phang Nga that I mentioned yesterday, it includes the closing of borders, domestic borders, for the general public, closing for domestic entry, with some exceptions like emergencies, medical supplies, or official business. This follows suit from Phuket, and for this closure of Phang Nga domestic entry would be from the 3rd, tomorrow, to the 16th of August, as mentioned yesterday. This would include entry by land, sea, and air, domestic air flights. So hoping for the best for these provinces that have been in the trial sandbox for us, hoping that the numbers will not increase. However, we are mindful that if the situation is severe and we are not able to control a rapid spread, these schemes would have to be realigned, readjusted, or even canceled. We're prepared for that. The locations that may pose risk for the spreading of the virus, where people congregate, of course, will have to be affected around the country. And many schools, as you know, have to conduct classes online. It's quite difficult for many young students. We are aware of that. So I guess this is all I have for you today, Monday, the start of the week. If there's any new information, emergency information, we'll surely come back and announce it to you, or you can follow information from our social media pages. Otherwise, we'll see you again this week, which would be on next Thursday, this coming Thursday. I thank you very much for your attention, and with that, have a safe rest of the week. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพนุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะคะ